A conference centre converted to an enormous makeshift hospital, part of Wuhan's response to the flood of new infections. Chinese state television broadcast footage of recently completed hospitals with multitudes of doctors taking care of few patients. But secretly recorded videos from hospitals paint a very different picture. Body bags containing the dead lying close to patients, even in waiting areas. This citizen journalist visited 4 hospitals in Wuhan.
People are not being informed about the real situation. State TV doesn't go where it hurts, but I think this needs to be seen.
The journalist found more body bags outside one hospital. Inside, he saw dying patients together in one room. He posted his videos online. Officials had him arrested, then released him after a public outcry. But in China, his online videos have been deleted.
Now, a cruise ship carrying people who may be infected by the deadly coronavirus has returned to Hong Kong after being denied entry to Taiwan. Health officials say that 30 members of the crew are showing symptoms.
The world dream has returned to Hong Kong, though it remains unclear whether passengers will be allowed to disembark. Coronavirus symptoms can take 2 weeks to surface, meaning suspected carriers must remain in quarantine for at least that long to prevent further transmission. Health officials have begun testing the passengers and crew on board, with confirmed cases already being sent to hospitals. The ship's arrival came as Hong Kong health workers began a 3rd day of strikes in the city. They want a meeting with Hong Kong Chief Executive Carrie Lam to discuss officially closing the border with mainland China, a move they believe would halt the spread of the coronavirus that has infiltrated Hong Kong and already killed 1 man.
We urge her to solve this situation by coming out to reach us and talk to us.
The World Health Organization has declared the virus a global emergency, but not a pandemic. In other words, it might be spreading, but don't panic.
Currently, we are not in a pandemic. We are at the phase where it's an epidemic with multiple foci, and we will try to extinguish the transmission in each of these foci.
China was praised this week by the WHO for its reaction to the outbreak, with the virus relatively well contained until now. Its arrival in Hong Kong represents a new challenge. This government must now also prove it is equal to the task of dealing with it.
And for more, we go to Charlotte Chelson-Pill, our correspondent in Hong Kong, who is at the harbour there. And Charlotte, we'd like to ask you what is happening with the passengers on board that quarantined cruise ship, because we heard that there was a man taken from the Hong Kong cruise liner into the ambulance after a coronavirus check.
Well, this is clearly going to be a very anxious wait for the passengers on board this cruise liner, as they're facing an additional extra night now quarantined here in this cruise ship. Now, what they don't know at this stage is exactly how long they will be there. Authorities have not said how many more nights they could be facing here quarantined on this ship. What we do know is that several of the crew members were displaying symptoms. They've now been taken off the ship and are being tested for that new coronavirus. We also know that on board this ship on a previous trip, there were 3 people from mainland China who were then diagnosed with the new coronavirus. And it is that which is causing so much concern for people on board this ship. Every now and then we hear announcements telling people to thanking people for their patience, saying it's not clear when they'll be allowed to disembark, that testing is being carried out. Every now and then people coming onto the balconies just behind me just to have a look around, just to see what's going on, looking at the press pack below, reporting as this situation unfolds.
So what is the mood there, given all of that, Charlotte? And how much of a risk is Hong Kong really facing from the coronavirus?
Well, everybody here has very painful memories of the SARS virus back in 2003, in which almost 300 people lost their lives. In a densely populated city like Hong Kong, with such close ties to mainland China, this is an area where this virus could spread very quickly. And of course, everybody knows that it could take up to 2 weeks before people display symptoms. That is causing a great deal of worry here. That is exactly why Carrie Lam encouraged people today to stay at home, to not go out unless necessary, to wear face masks as well. People that we've spoken to say, though, that they ideally want all of the borders with mainland China now to be closed. It's for that reason that medical staff are on strike at the moment, demanding just that, saying Hong Kong needs to take as many preventative measures as possible to stop the spread of this virus. Carrie Lam announcing today further measures. She said anybody travelling from mainland China will now be quarantined for 14 days as of February 8th in an attempt to try and stop the spread of this virus.
Charlotte Chelson-Pill in Hong Kong. Thank you, Charlotte.